I want to tell you about three people, Dave, Connie, and Meryl. So Meryl Comer, C-O-M-E-R, wrote a book entitled Slow Dancing with a Stranger, Lost and Found in the Age of Alzheimer's. It came out in September, and I highly recommend it for everyone in this group. Only a person without any sensitivity could read this book and not conclude that Meryl Comer is among the most loving, caring, devoted, and faithful spouses in the world. The book enlightens readers about how cruel dementia is and how huge the burden of caregiving is. Mrs. Comer's life illustrates how Alzheimer's affects the loved ones and caregivers for whom she has coined a term that is unfortunately apt, POA, which stands for Prisoner of Alzheimer's. As you all know, there are 5.5 million people who have Alzheimer's now, and there are 15 million caregivers, and that 20 million people is going to triple by mid-century, most likely. Her husband was the chief of oncology and hematology at the National Institutes of Health in his 50s. And his symptoms of dementia began when he was 56. He is now 77. His disease destroyed their careers when they were both in their prime. Ms. Comer was a TV business reporter and more, and even interviewed the first President Bush. Young onset, or some people call it early onset dementia, people can have very long survivals. They can go through a variety of psychiatric states. And in Harvey Grandlick's MD PhD's case, there were changes in his personality, aggression, and violence, which are sometimes seen in dementia, very often seen of the Alzheimer's type, and very often seen in Huntington's. But I want to focus on the role, as she portrays it in her book, of physicians and other healthcare professionals to adequately diagnose, to give an accurate prognosis, and to provide other critically important information, all of which can have an enormous potential on the course of people's lives. One of the things I love about Slow Dancing with a Stranger, Lost and Found in the Age of Alzheimer's, Mrs. Comer's book, is how honest she is. Truth, with a capital T, which sometimes takes second place, and for good reason. I mean, if you are the spouse and caregiver of someone who has early dementia, you have a choice between telling the truth or trying to preserve his dignity and making up for his deficits. And she says she would bring her husband to cocktail parties, and as long as they kept moving and no one was talking to him, no one knew. He was beautifully dressed, a handsome man, great physical shape. So what does she say about caregivers? Is sometimes they have an ambivalent role, preserve the dignity by keeping the secret. They are the keepers of the secret. That does not apply to professionals. So I'm going to tell you about three events: wrong diagnosis, wrong prognosis, and inadequate information. She brought her husband to one of the top neurologists in the Washington, D.C. area, who was about ready to retire. And of course, Harvey Grandlick was on his best behavior, because she came armed with a date-plotted list of symptoms and behaviors that not only she recorded, but also had been collected from his co-workers at the National Institutes of Health. And she presented this to this neurologist, who then took Harvey in the back and gave him a neurological examination. And he veered on the side of preserving the dignity, preserving the job of his colleague. And his words when he came out were, "No gross abnormalities, just stress and perhaps a bit of depression. He's in great physical shape. Take a vacation. relax. And the notes that Meryl Comer gave him to put in the chart were not there when she requested the chart later on. One of Ms. Comer's goals in writing this book is that no one should have to go through what she went through. Regarding her disappointment with this neurologist, she wrote, and somewhat generalized, clinicians are reluctant to diagnose because they can't effectively treat. But there are other things that you can do. What can you do? You can plan your finances. You can plan your living will and your advance directive. Please know the inadvertent trauma you inflict on families left confused, hurt, and helpless. Then time runs out on the ultimate conversation with our loved ones about our end-of-life wishes. Their minds are erased. It is simply too late. And in addition to that, Miss Comer was not only dismissed, she became the enemy. I lost my standing as his defender. Harvey treated me as his enemy, someone he could not trust. A dementing mind, she generalizes, sees only its own reality. This diagnosis, not given when he was 56, delayed his diagnosis for 2 years. There were fewer options. Dr. Rabin at Hopkins finally prescribed Aricept. And you know that drug does much better the earlier you prescribe it. The event number 2 of giving her the wrong prognosis. Maybe clinicians want to give hope. They looked at the rapid onset and progression of the symptoms that Harvey was experiencing. And from that, they projected that he would probably have a disease that would run its course in just a few years. She heard that several times. Based on that, she decided to tough it out. But they didn't know. They couldn't predict what the prognosis was. He was a man who was in terrific physical shape. She was even bringing him to a gym to do muscle strengthening. Approximately 27 more years gives you the life expectancy on average for a 58-year-old man who's in good physical health. Why wouldn't he live 20 more years? Yet part of the reason why Meryl Comer decided to tough it out was because she figured, I can handle it for this amount of time. Perhaps she had been advised more appropriately, she would have considered other decisions. Event number 3, inadequate advice regarding the choices that were available, the options that she had, and what was moral and ethical and clinically appropriate. You know, the default in our country has been and still is to do everything possible to give everyone the best possible care for as long as possible. So she keeps on providing Harvey this best care, despite knowing what his wishes really were, what he would have decided for himself if he had had a moment of clarity by some miracle to judge and to say, okay, if this is my diagnosis, this is my prognosis, this is what I would want to do. What I've just defined, of course, is substituted judgment, which she knew. And she could have applied that to whether hand-feeding and drinking was providing a benefit as opposed to merely prolonging his dying, increasing his suffering, and being a huge burden. She actually did exercise substituted judgment once in the heat of an emotional crisis. He was in the hospital for working on his behavior, and he got a deep vein thrombosis, which, as you know, is life-threatening. So they started giving him Coumadin as a blood thinner, but he was a very active and aggressive, walking around all the time type of guy, and they were afraid that if he had an accident, he would bleed to death. So they wanted to give him bed rest and keep him restrained. 4 orderlies came in to hold him down and to put him in leather restraints, which he fought furiously. It was torture. He couldn't understand what was happening to him. And she said, in an emotional reaction that was perfect, judgment, let him walk. He wouldn't want to live like this. She writes, quote, I searched to no avail for some kind of advance directive so I could execute his last wishes. It had been on our to-do list because we gave each other power of attorney in the event that we got ill. That was early in our marriage. She pondered, quote, what should I do? Divorce, institutionalize him, send him to his son, assist him to end it all because without his intellect he was no longer himself. This felt immoral to me and I knew it was something I could not do. Listen to this. For someone like Harvey, hanging around wasted and dependent would be more abhorrent than death. When he was cogent, before the disease took hold of his mind, he had those exact words, but left no written directives. Harvey's denial about his own descent into his disease would be his own undoing and mine. She's blaming Harvey. If Harvey had not been in denial, we could have planned better financially on how to care for him, and he could have written down his express wishes on how much he wanted in terms of care and when to stop. But it's not entirely Harvey's fault. You know, the role of the psychiatrist is to break through denial. That's one of the things we do. Resistance and denial. Where is it? I take out my psychiatric hatchet. Okay. It's also the fault, and this is the event number 3, of lack of adequate information on how to make these very difficult end-of-life decisions. To my knowledge, no one told Ms. Comer that her knowledge of what Harvey wanted, knowing his values, knowing what treatment decisions he would have made for himself, would suffice, according to the honored protocol of medical ethics called substituted judgment. If those were his exact words, that's all she needs. And she can make decisions based on that. So where is Harvey now? In the last 2 years, he's had much difficulty swallowing, losing weight, unable to hold up his head, has seizures, his skin is blue. He spends all of his hours in a wheelchair with his eyes closed, drooling, making no eye contact, hasn't spoken in 7 years, a single word. His last word was in 2001, his own name. So she summarizes, Harvey and I have been slow dancing with a stranger for years. Alzheimer's captured us both. It destroyed a wonderful mind and our life together. When I stare in the mirror, I see only exhaustion and 20 years lost. I hope you have a chance to see the 4-minute video that I sent out. She says, I'm still looking for the same thing I wanted when I first learned that Harvey had Alzheimer's disease. A way out for us all. And now here's what she says. Unlike Harvey, I've left clear directives about what to do if I am incapacitated by Alzheimer's disease. I want to be cared for at my home, not in a facility. And if I can no longer lift my hand to feed myself, I don't want to be fed or given water. This hopefully guarantees that I will not live with Alzheimer's for very long. I do not think my son Jason will feel comfortable with my decision, but being a burden haunts me more than death. Listen to this sentence again. This hopefully guarantees that I will not live with Alzheimer's for very long. That's an oxymoron, to hope for guarantee. You got it, Marshall, right? So, people who read the account of Harvey's 21-year descent from the chief of oncology, hematology, the National Institutes of Health, to drooling without having uttered a word in 7 years, are going to say, I don't want to live for a long time in the advanced stage of dementia. It's better said, I don't want to prolong my dying in advanced dementia because advanced dementia is a terminal illness. It just is one that takes a long time. And so what are their options? One option is what Gillian Bennett did in Canada, who was on the front page of the Vancouver Sun. She had early dementia, and she, without any help from anybody, her whole family was there, but they knew legally they couldn't help her at all. She dragged a mattress from her chalet to the side of the mountain and then took some barbiturates that she had been storing for a whole bunch of years, and she died. Because she did not want to have a prolonged dying in advanced dementia.